Okay, uh, today I'm going to discuss about. Today I'm going to speak about how the condition affects the patient emotionally. So, the telling about the emotional rhythms. The emotional rhythms of the that is the conditions are often checked when that is the medical care is carried on. When a medical care is carried on a patient, the doctor should check how the emotional rhythms of the patient is going, is if he is stable or not. And telling about the next point, it is very essential in a patient to simultaneously diagnose as well as treat his depression in a medically ill patient, because then only the uh, then only the then only we can, that is the doctors can tell the patient if that is to maintain the his or her condition with a in a more peaceful way. And telling about the third point, the clinicians can play a great role, that is to help the patient to how they can cope up with their health skills, and also advise them to maintain their emotional balance. The next, let's see, please. And the fourth point is that the clinicians can also consider, that is their if a patient uh, telling about his professional growth, if he is satisfied with his professional growth and how he can find happiness in his or her job, and if he can be, what to say, be very happy with his work. And the next point is that the clinicians should also look into their critical role, that is the patient's relationship, that is about their surroundings, that is their neighborhood. If they can find happiness, or they can, and also they can maintain a sense of balance. That's all from my part. I'm handing over it to Sinju.
Thank you, Dwight. Good morning, all. I'm Sinju Marijon, and today in this presentation, my topic is involving patients in treatment and decision. So my groupmates have already discussed about other things. So while talking about involving a patient in their treatment plan, the first step is to give the patient a better knowledge about their treatment plan. For example, when we start with a patient, we have to say that patient, you are going to undergo these process. Like for example, in cancer, you will be undergoing chemotherapy at this part, you'll be undergoing other operations in this part. And another point is selecting economically suitable treatment plan. That is, we know that different patients come from different family background. Some of the patients will be well off and they can manage with their treatment plan. They have enough money to spend. And in case of some other families, it is tough for them and they can't go through the actual medical plan or treatment plan. They have to get loans, they have to borrow money from others. So the doctor who is giving a suggestion for their treatment plan should basically check their economic condition so that they can give a suitable treatment plan for them. The other point is patients should be asked whether they want to be involved in treatment planning. In this point is related with TIDES part, how a disease will be affecting a patient emotionally. So if a patient is not emotionally stable, they can't accept the treatment plan which a doctor is saying. So while we ask a patient that whether you have to be involved in your treatment plan, this sometimes we will get a positive or sometimes we will get a negative answer from them. But we should make sure that at least once we ask them whether you have to be involved in this treatment planning. And talking about the next point, it is minimize the chance of undesired consequence. It's very well known that when we not involve a patient in their decision while taking treatment plan, like when we don't ask them whether you have to be involved in your treatment plan. At end, if some consequence appear, there's a chance that the patient may completely put the burden on the head of the doctor. So we should take care of that also. And while making the patients to be involved in their treatment plan, there are certain things that varies and that can affect the decision of the patient. Among them, one is age. We can say that if a person is young, he can make a decision which is appropriate for his current age, current situation, and all of that. When we take this to an elderly people, we can see that they will be a bit confused, like whether this treatment plan will go correctly. Is this simply spending money? So age comes as a criteria. Another one is educational status. For this was explained by Hepzibah in the beginning. Like when we talk about the educational status, if a person is well educated, he can understand the complications and also the medical terms and what all the doctor are saying. But if a person is an illiterate, then the doctor needs more effort to make the patient understand how it is going to work. And also disease severity. The disease severity, while we talk about this, some patients may have very bad diseases, so they have a problem in selecting their treatment plan. And for small diseases, like if it is a common fever, we know that taking a medication for a week, it will be able to cure the disease. But for treatments like cancer, it is a long-term process. So the patient must be mentally and also physically prepared for this thing. And about nationality, in different nations we have different cultures, so it may also affect the decision making. And also ethnic origin. In a country, for example, if we take India itself, it's a great country, it's a vast country, and which has a lot of ethnic groups. So for example, we have Muslims, Hindus, Christians. They have different ethnic cultures within them. So these cultures may be a hindrance for them to do or to involve themselves or to create or to select the treatment planning. Next. Let's see. And the other one is to the best way to involve patients actively. This also have some conditions, and this can be detailedly explained in certain points. The first one is condition. How the condition, if the person is physically challenged or need a help of other bystander to convey his opinions while taking a history from that patient. So this condition may also affect a patient's decision making. Then the treatment options. When it's normal that when we give an option to the patient, we give these options. You have this option as well as the another option. You can select. So while giving two options, it's normal that the patient will be confused, and that patient needs more time to adapt themselves to that situation. And also the outcomes. The doctor should explain the outcomes of this treatment completely to the patient so that he can choose a better option. And talking about the uncertainties, when a patient undergoes certain treatment, they have this confusion whether this treatment is good or I will end up at a bad situation after this treatment. So it is common that these patients have such confusions within them. The other one is check whether the patient understood the information and can access the implications. Like if the patient has understood the whole procedures well, then they will undergo the treatment. And if any other consequences which comes at last, if it comes, the patient is ready to accept that. And the other one is evidence-based patient decision aids to help in this process. For example, we can say when a patient is undergoing a new surgery, which is not that well known, that patient has a doubt whether this surgery is useful or whether he will end up at a bad situation. So when a doctor uses an example of this surgery, which was done on another person, he can clearly explain that this surgery is done in this method, and it was not that effective for some person, but this particular person has overcome this. This gives an mental support for that people who's or patient who is listening this, so he can make a further good decision. And the last point is giving the patient the right to accept or reject the treatment plan. We can't force a person, like a doctor can't force that patient to take you. He can't say that you have to take this treatment. It's compulsory, but we must ask for the opinion of the patient, and we should respect his choice. Whether he accept or reject it, we should respect his choice. That's all from my part. And in the next few slides, we have some questions for you guys, and we think that you will actively engage yourself in these questions. Thank you.
Yeah, so firstly, we'd like to ask some questions. That is, the first question is that doctors should listen to whose explanation first, unless he or she is physically challenged. So, what do you think? Anyone can answer. What do you guys think about bystander or a patient? Whom should the doctor listen?
Can I?
Yeah, you may.
The option is patient, because the patient is the one who is going to have the particular treatment. So he or she must be agreeing, or he or she, the valuable words from this patient is necessarily to be taken in point, and the medications or the operation or certain things must be explained in a good and clarity manner, so that he or she can understand it. So patient is the person to whom we should listen.
Yeah, the right answer is patient. So next, Labib can answer ask the question next one.
Yes, yes. And the second question is that include patient's family in healthcare treatment. Anyone? That yes, there are two options you guys can select with the consent of patient, and second one is without the consent of patient. So anyone?
Yes, it is with the consent.
So the answer is given.
No patient.
Yes, yes, right answer. And the next question will be asked by Toyib.
The third question is that state some points to keep in mind while talking to the patients. Can anyone tell the answer? Can anyone tell the answer?
We should keep in mind the person's physical condition and mental state. We should ask the question in a manner that he or she is not feel offended. The questions should be, we should be aware of the non-verbal conversation. That is, we should make the person feel comfort, and we should be confident about our question. We should always keep the eye contact with the patient. Then when the patient is speaking, we should listen to him with full with full 100% of involvement. Then we should reason and validate the patient's opinion.
Yeah, thanks. The next question will be asked by Sinju.
So my question is whether the emotional condition of patient should be taken into consideration or not while that person is undergoing a treatment. Anyone, please?
Should be considered.
Yeah, you're right. The emotional condition of a patient should be considered. So that's all from the question part. moving on to the conclusion, the treatment of a patient completely depends on the trust which he or she has on his or her doctor. And this trust is not earned by a single consultation. It needs an active interaction between the patient as well as the doctor. And this active interaction includes a complete explanation of the patient's situation and also his queries and also his concern about his treatment plans. And active interaction between the patient and doctor makes things much easier than making it much complicated, while it clears all the queries of the patient. So this is from our part, and we think this presentation was informative. Thank you.
Thank you, ma'am.
Sure, it was. Well, and so can I ask somebody to comment on the presentation and to say some words, recommendations, and your opinion about the presentation that we have just seen? Somebody from another group.
May I?
Yes, please.
Yeah, from the two things which I found from the presentation which made me listen them is, from the beginning itself I can find the confidence from each and everyone who are presenting. From the conference, we can understand that they are clear about their topic and they have well prepared for this presentation. And their content was a simple topic, but still they have tried a level best to make us understand a lot. And each and everyone has presented their presentation in a very good and clarity, with a fluency and clarity in their words. And they have explained in what they have understood from them. They're just not rather reading, just they are not reading simply, but they are explaining what they have understood. And they have having just a reference, they are keeping the PPT as just a reference. That's all, ma'am. Thank you.
Okay. Does anyone else want to share your opinion? Okay, so I would add that what I like in this presentation also is that you made it interactive. I mean, when you shared the information with us, you also checked how well we understand the information, and that was very good. Okay. Thank you so much. And
Thank you.
Thank you, ma'am.
do we have any more presentations? Yes.
Yes, ma'am, we have one more presentation.
So who's going to speak now?
Good morning, ma'am. We are subgroup number 3 of group 1. So today we the people of group 3, that is me, myself, that is Umbertal Ashwadi Shaji, Ansila, Asna, Shemisha Sheril, and Remisha Sheril. The topic which we are going to talk about is a simple topic, that is a calorie Cambridge method. This is one of the consultancy method, and let me give a small introduction to our topic, because many of the people are unaware of this topic, and I hope we will make you understand after this PPT. So before talking about the calorie Cambridge method, let us talk about the communication. Basically, when we talk about communication, it is something which is we are giving, or it is an act of giving or receiving or sharing the informations through verbal or non-verbal forms. So good communicators will listen carefully and speak, or they will write clearly with different opinions. And the people who are unable to speak verbally, they talk through their actions. And communication is a teachable skill which is incorporated in the training of the medical profession. And why it is important is because through communication only, the doctor and patient, the bond between the doctor and the patient will be increased. And teaching of communication skill is based on the model of the communication, and it can be of a research or by a clinical data or something like that. So Calgary Cambridge method, it is a consultation model, as I said before. It is they are not rules, but they are the learning aids which will help to develop our own skills of consultations. And Having our own model will ensure that we will have an internal guide to draw for the consultation and to achieve a best outcome from the patient. So this consultation will create or will make an awareness about the disease or something which he or she is suffering. So Ansela will continue with the other part.
Good morning, ma'am. The Calgary Cambridge model, it's a method of teaching that helps in the process of communication as well as the effective gaining of content information. And this model is important because it helps in patient-centered medicine, including the building of relationship and shared decision making. And the patient, providing the patient-centered medicine, it helps to make an individual patient's preferences, respectful of and responsive to these patients' needs and values. And the person's centered care helps you to find the suitable ways to help them communicate and maximize the quality of care. And this provides a structure and helps in building of relationship, and hence it make the decision making more important. The next part will be continued by Ramisha.
Yes, ma'am. Good morning. The Calgary Cambridge Guide to Medical Interview was developed by three authors, Silverman, Woods, and Draper, to delineate effective physician-patient communication skills and to provide an evidence-based structure for their analysis and teaching. Within the UK, over half of UK medical students now use Calgary Cambridge approach in their communication skill programs. It has been widely translated and is used in USA, Canada, and Europe. It has been used to teach communication in general practice and specialist environments at undergraduate and postgraduate level. And these guidelines, which present the medical interview in 5 steps, that is the initiating session. Second one is gathering information. Third one is physical examination. Fourth is the explanation and planning. Last section is the closing session. And Asna, please don't change slide, please. And when we talk about the authors, Asna, can you? The authors propose a comprehensive clinical method that explicitly integrate traditional clinical method with effective communication skills. To implement this more comprehensive approach, they have modified their own Calgary Cambridge guides to medical interview by developing 3 titles that visually and conceptually improve the way communication skill teaching is introduced. And that place communication process skills within a comprehensive clinical method, devising a content guide for medical interviewing that is more closely aligned with the structures skill used in communication skills training, and incorporating patient-centered medicine into both process and content aspect of medical interview. This enhancement help resolve ongoing difficulties associated with both teaching communication skill and applying them effectively in medicinal practices. The guide was originally intended for use in clinical education at tertiary institutes. And the aim of this study was to investigate the initially reliability of simulated patient consultation, such as those who might use in training as a precursor to its use with a real patient consultation. And to assess reliability, we asked 5 specific questions that is I explain the Shemisha explain later in next slide. And let me hand over to Shemisha to explain that steps. Shemisha. Hello, Shemisha. I think, ma'am, her network is low. She will join.
Hello, ma'am. Hello, ma'am. Can you hear me?
Yes, we can hear.
Yes, ma'am. I'm Shamisha Cheryl, and I'm going to talk about the 5 steps in Calgary method. The first step is initiating the session, and the second step is gathering information, and the third step is a physical examination, and the fourth step is explanation and planning, and the fifth step is closing the session. We know that in the initiating section, first of all, for a better management, the pre-consultation period should be used wisely by the clinician. That is the first few minutes, that is the interaction between the clinician and the patient should be arranged a method for the consultation. And this period will determine the patient how he share his information to the clinician. So we have to so the clinician should use in a better way. The mindset of the clinician and the patient should be in a correct proper manner. If any negative mind keeping in the clinician or patient, it will affect the clinical error may cause. First of all, if before initiating the session, it has many three steps. That is, the preparation should be taken, and establishing initial rapport, and also identifying the reason for the consultation. Actually, the clinician should ask about why he came for the consultation, what was he suffering from, and the initial rapport means it is the well method in a initiation section. That is, he should also allow for a couple of minutes between a patient to end of the earlier consultation and get into a neutral mindset before one set of the new appointment. And we have to the next section is about the gathering information, that is exploration of the patient's problems to discover about the biomedical perspective. It is actually the biomedical perspective is actually about the disease. The clinician should ask about the symptom and how it's long lasting, or previous background, such as the background information also should ask about the clinician, that is any family history, or what he was suffering from earlier, and that disease is still suffering, or like that should be asked by the clinician. It will be a better for the consultation for the doctor. And also we have to know about the physical examination, and the fourth one is about the explanation and planning. By this, the providing correct and amount of information, aiding accurate recall and understanding, achieving a shared understanding. And the fifth section will be the closing section. After talking or speaking about the complete idea, complete information about the patient, the clinician forward the planning. And we have to, the clinician should be take a know about before allowing the patient to the doctor. The a good open relationship should be needed between the patient and the clinician. That is, an open speaking mind will keep a better understanding between the patient and the clinician. That is, the clinician should be speak in an open manner, like that he's introduce himself and can ask some questions about, can I help today, how can I help you. Such questions may ask, and this get a relief for the patient, and he can disclose what he's suffering from. And this is a diagram showing that the Calgary method, ma'am. And now I'm handing to Asna, ma'am.
Ma'am, okay. The Calgary Cambridge model.
Too many Calgarys. Can you help us now give a piece of advice how to avoid this kind of echo during the session? What should she do?
It's because she used two devices to enter the meeting, ma'am. She wanted to present it from the computer and she used the phone to enter the meeting. So we already asked her to cut any one of the devices. She'll be back in a minute.
I see.
Ma'am,
Okay.
ma'am, can you hear me?
Yes, we hear you.
Okay, ma'am. And this Calgary Cambridge method is a model to provide a practical integrated method for teaching both the process of communication and as well as the effective gaining of content information. And it incorporates the importance of patient centered medicine, including a building of relationship and shared decision making. And this model since has been adapted used in various health disciplines and serves as a blueprint of many educational institutions of in teaching and education and aspirant of healthcare professions. And the main challenges experienced in this learning of communication is to include the integration of communication skills with other clinical skills and the effective carry over of theoretically taught communication skills is not real life scenarios. And this Calgary methods model do is a global consultation. In global consultation rating is based on widely used Calgary bridge gate to the medical interview and is designed to evaluate the practitioner communication skills across the entire consultation. And with linking the identification of potential training need to be established approach to learning teaching. And this model is provide a practical integrated method of teaching both the process of communication as well as effective gaining of content information. That's all my part from. I'm hand over to Ashwadi.
Uh, uh, After this, I hope you all have understood about the Cambridge method. By this, I'm concluding that the consultation model that will provide a potential structure for the complex interactions which is occurring between a patient and a doctor. That is a simple communication between a doctor and a patient. And medical consultation is best understood as two-way social interaction. In typically the consultation, the doctor will collect the information from the patient, then offers a diagnosis or an opinion, and discuss with the treatment with the patients. So from here, we can find that the consultation model or the Cambridge model, it involves an interaction between the doctor and the patient, and that is it is an interactive decision making. So we are here concluding this presentation. I hope you all have understood, or we hope that we have created a small idea about this topic. Thank you, ma'am.
Okay, thank you so much. I have a question to the last speakers. So about when we speak about this Calgary Cambridge method, is this method applicable to all cultures, or does it have any limitations in different cultures?
According to culture, this method is almost applicable. According to the consultation, there are different methods of consultation models in which this is considered as the most applicable method, and because of which this is the method which is used by the doctor while having consultation. So according to culture, it may change according to the way of speaking, or we can find only through like small difference in the communication because of the change in culture, but rather than it is common in every case. And this is an easy and simple method so that they will have a better knowledge about the disease as well as the treatment which they have to give.
Okay, thank you.
Thank you.
Well, and I welcome the students from the other groups to give your comments on this presentation, to share your opinion.
Then I think that this presentation was interesting. The choosing of the color of the slides was interesting, which made us go to look through the slides, and they have given a flow chart which helped to conclude this data or integrate this data in a small manner, which make us understand what the method is in a short and fluent way. By looking at this one slide, we can understand what the method is. If from the procedure of structure, how should we should initiate the session with asking the question, then we should gather the information, then we should conduct the physical examination, then explanation, then planning, and the close the session. So we have got what from start to end, the procedure is clear from this one diagram, and also they have explained each and every point to the detail. So I'm very happy with this one presentation, and now I'm clear about the Calgary Cambridge method. Thank you for all the feedback.
Great, thank you. So, and as for me, I would like to recommend, and this is recommendation not only to this group of speakers only, but also to the other groups. It's better to have some kind of reference on one of the slides, on the last slide. I mean, what kind of resources you've used in your presentation, because all the diagrams and all the information that you've presented, it's not the information that you invented yourself. You've used this, you found this information somewhere, and we need to know the resources, and you should just place the information about the resources somewhere in your presentation. Okay. Well.
Okay, ma'am.
Mm-hmm. And so yes, we have less than 1 minute, and we need to finish the second class, and